Hello, everyone. Welcome to another session with Pharmaceutical Calculations with Dr. Dave. This time we're going to look at specific types of calculations that are involving generation of a dose, which is what we've done before, but also the dose adjustments that might be needed based on weight and other patient parameters. So the first thing we're going to look at is pediatric patients. So pediatric patients sometimes are going to need dose adjustments. And we term kind of pediatric patients if you want. There's different terms for the age groups of pediatrics, but from the World Health Organization, you can see the chart that talks about if it's an infant, if it's a child, if it's an adolescent, and what age group that they are referring to. But what's more important for us is the calculations that you will sometimes see in references in books and on packaging for some products that are for pediatric patients. So let's look at an example here. This first example, it says the dose of dextromethorphan for pediatrics 7 months to 1 year is 2 to 4 milligrams every 6 to 8 hours. So if you were to look that up, dosing for a child from 7 months to 1 year, it's going to say you can give them between 2 and 4 milligrams every 6 to 8 hours. Now the dose and the dosing interval is sometimes based on the prescribing practitioner and the level of need for the patient based on the dose. So there's usually sometimes ranges. So if you see these ranges, and the question that I'm asking is, what is the highest dose that a 9-month-old patient should receive? So 9 month is between these, right? So between 7 months and 1 year is 9 months, and we do know the dose. The dose that you can give is 2 to 4 milligrams, and that's Q 6 to 8 hours, right? So that's every 6 to 8 hours. So, but what's the highest dose? Well, the highest dose that a 9-month can receive would be, first, let's look at the dose. They can get 2 to 4 milligrams. The highest dose that they have is 4 milligrams, and they can get it every 6 to 8 hours, which is more times a day, every 6 hours or every 8 hours, well, every 6 hours. So we know now that the most that somebody can take is 4 milligrams every 6 hours. Right? So it's 4 milligrams, right? And that's Q 6 hours. And if you were to take so you take 4 milligrams, right? Every 6 hours in a 24-hour period, right? That means that they can take it 4 times a day, right? 4 times. So 4 times 4 would be 16 milligrams per day. Let me just go back there. I'm looking first at the highest dose that they can have. They can take 4 milligrams every 6 hours. Every 6 hours in a 24-hour period is how many doses? This is 4 doses, right? If it was every 8 hours, this would be 3 doses, right? Do that. So we're talking about Q6 hours is 4 doses. So that's 4 times a day. And that's why I'm going to be getting 16 milligrams a day. If I asked what the lowest was, the lowest would be 2 milligrams every 8 hours. Every 8 hours is 3 times a day, so 2 times 3 would be your 6. All right, let's go down to the next question. It says, of the concentration of dextromethorphan in a solution, right, so is 7.5 milligrams per 5 mLs. How many mLs would be needed for a 3 milligram dose? So this is a separated question. What this question is saying is that you have a bottle, right? Here's your bottle. It's dextromethorphan, DMX. It's got a concentration of 7.5 milligrams per 5 mLs, 5 mLs being a teaspoon, so 7.5 milligrams per teaspoon. And if you wanted to give a child 3 milligrams, how much of this liquid would you pour out and dose to the patient? We should be familiar with this. You know that every 5 mLs is 7.5 milligrams. How many mLs if you want 3 milligrams? I'm multiplying this by 3. Right? And if I do that, I should get about 2 mLs. So 2 mLs of this liquid right here will give us the dose of 3 milligrams. There are some things that are dosed by drops. It's not that common anymore, but we sometimes will not only just things we'll see things that are dosed by drops, but we also will make formulations, and a lot of times the ingredients that we're going to be doing in compounding for flavoring and things like that might be dosed by a number of drops. You'll also see drops with eye drops and things like that when you have to calculate things like day supply. Now, there is no exact equivalent for what one drop is, meaning how many mLs is in one drop. There is no specific amount because the amount will vary based upon the liquid, the properties of the liquid, as well as the dropper that you're using. If the dropper has a more narrow opening or a bigger opening, the dropper size or the drop size will be different. However, there is something that we call an official dropper. The official dropper is 20 drops per ml. Now, sometimes you really don't use that official dropper, but it's a good starting point, excuse me, for most standard droppers. Usually, though, if you are going to see something with a dropper, a lot of times you will see the dropper that's already calibrated, or even for eye drops, the dropper is calibrated to deliver a certain number of drops or an ml per that drop. However, if you don't know how many mLs are in a drop of some dropper that you're using, you can always do it yourself, right? So how do you calibrate a dropper? Meaning, how do you find out how many drops there are in an ml for the liquid and the dropper you're using? Well, here's an example of how you do that. So it says a pharmacist calibrated a dropper, and by calibrating a dropper, it means that you are finding out how many drops there are in an ml. That's all it means. So they're using the dextromethorphan solution from above, right? And so instead of doing it by teaspoons, they want to do it by drops. So instead of giving them by a liquid amount, we're going to do it by drops. It was determined that 38 drops fill the graduated cylinder to 2 mLs. So this is how you can calibrate a dropper, right? You're going to have a graduated cylinder, and you're going to start to drop from your dropper down into the graduated cylinder. And you're going to count the number of drops. And what this pharmacist did is they kept dropping into there until they got to the 2 ml mark. When they got to the 2 ml mark, they counted 38 drops. That's what filled the graduated cylinder to 2 mLs. Now, how do you calibrate that? Well, you want to find the number of drops per ml. So drops is what we want per ml. That's what we want to look at. Now, another way of writing drops is we can say GTT, which is a dropper. You can actually sometimes put the S there for drops. So we're looking for drops per ml. Well, if it's 38 drops is 2 mLs, right? You know that for 1 ml, right, you're going to have half of that and be left with your 19 mLs, all right, per 1 ml, or sorry, 19 drops rather, sorry. 19 drops per 1 ml. Okay, but the question is asking us how many drops, so based on this dropper now that we used, how many drops would be needed to dispense 7.5 milligrams of dextromethorphan? Well, we know that the concentration of the dextromethorphan from the above was 7.5 milligrams per teaspoon. So this right here, 7.5 milligrams, was in a teaspoon. I'm going to show you that. So, here's right there. You see, it's 7.5 milligrams is in 5 ml. So we don't have to do any math for that. But what we do have to do is find out, well, how many drops is that equal to? So what this question is really asking me is, it's asking me how many drops in 5 mLs, right? How many drops would it take to get 5 mLs of this dextromethorphan liquid, right? So you can do it either with the new number or the original number, but we can do the original number so that we would see how we would do it straight out. So you would say there's 38 drops is equal to 2 mLs, right? How many drops if you've got 19 ml? Or sorry, let's try that again. How many drops if we want 5 mLs? All right, that's what we're looking for. So if you do that out, if you take your 38 drops times your 5, you're going to get 95. So 95 drops. Take you quite a while to do that. Count 95 drops. But For the question, that is the answer. So that's how you can calibrate a dropper. Calibrating a dropper just means you take a graduated cylinder, you start counting drops to a certain number of mLs that you want. You could just stop at 1 ml, but a lot of times people will go higher so that you get a nice, better average than that. So you can even go up to, let's say, 5 mLs, find out how many drops it took you to get to 5 mLs, and then you find the drops per ml. Not to confuse things more, but there is something that are called dropper fulls, right? Dropper fulls. So many products that you'll see, so especially some over-the-counter pediatric formulations, things like the liquid pain medications and fever reducers like Tylenol, will sometimes come with this, which is a dropper, right? And they sometimes will come with these oral syringes that look like this. These droppers are not something that you will see that you count the number of drops like we did. They just look like a dropper, but they have actual ml marks on there. So this one says 0.8 and then 0.4. So they are products that you fill to this line. You don't count drops out of the bottle. So they call them dropper fulls. And there was some confusion because patients used to see this dropper and the directions would say 1 dropper full. And people used to fill the whole entire thing up and consider that 1 dropper full, but it's not 1 dropper full. When they say 1 dropper full, they actually meant to this first calibrated line, and a half a dropper full was down to that line. So confusion does arise with these. Let's look at an example here. You have acetaminophen oral solution. It's in drops. It's for infants, and it's available as an 80 milligrams per 1 dropper full. And that's 80 milligrams. I'm going to erase all this stuff here. 80 milligrams per 1 dropper full. But 1 dropper full for them is right here at the 0.8 mark. All right, so it's 80 milligrams per 0.8 mLs. And it says how many dropper fulls will be needed for a child weighing 11 pounds when dosed at 8 milligrams per kilogram every 6 hours. So we are going to do this in dropper fulls, not drops. Dropper fulls. Dropper fulls meaning the device itself, the dropper. So we're first going to find out when we say the pounds, and it's going to be 8 milligrams per kilogram. I'm going to convert that pounds immediately. I'm going to say 11 pounds, right? Divided by my 2.2. I'm going to get 5. So that's 5 kgs is what the patient weighs, okay? Next is that's dosed at 8 milligrams per kilogram. 8 milligrams per every kilogram, and I'm going by 5 kilograms, right? 8 times 5, you got your 45, right? Or 40 rather. And now this is 40 milligrams Q, 6 hours, right? So now we converted the milligram per kilogram to a dose. So the dose is 40 milligrams every 6 hours. And now we're looking at, well, how many dropper fulls would that be? Well, let's see. 40 milligrams is how many dropper fulls? Well, we know that 1 dropper full is 80 milligrams. So how many dropper fulls will be 40 milligrams? We're going to know that that is that 1/2 of that. Or 0.4 mLs, which is half a dropper full. Remember, dropper full is confusing because they're not talking about the full dose. This is 1 dropper. This is the half a dropper, meaning on the mark. So people who do get confused with that. I did this in 3 steps. Can you do it all out, straight out in dimensional analysis? You certainly can, right? If you want to, you draw your line equal to, what are we looking for? We're looking for dropper fulls, right? And we can say that, so 1 dropper full is 1 dropper full is 0.8 mLs, right? There is 0.8 mLs as 80 milligrams. We have 8 milligrams per kilogram. And the person weighs 5 kgs, 5 kilograms. Our kilogram goes, our milligrams go, our mLs go. We're left with our dropper full. All right, so that was pediatrics. The next thing that we're going to look at is geriatric patients, so older patients. And adjustments in medication are usually based on several factors, based on their physical condition, their age, and weight as well. Also, some other drugs that they may be on, or just because they're experiencing adverse events. But we're going to look at a few specific ones that you might see um, for that. So let's look at an adult dose. It says the adult dose of medication is 500 milligrams of a drug every 8 hours. For JP, who's an elderly patient, they have impaired renal function. So the drug is going to be taken by the patient and it's going to be excreted out of the body by the kidneys, which is what renal is. The reason why we're making a dose adjustment is that if every single time the person takes a dose every 8 hours, if the drug is not being eliminated by the kidneys, the drug is going to build up in the system because the kidney can't basically flush the drug out fast enough every time you're replenishing it. So you sometimes will either reduce the dose or you reduce the frequency. So the directions on this particular product says that in patients with impaired renal function, you should actually reduce the dose. And you'd reduce the dose by 25%. So if you want to reduce the dose by 25%, you would simply take the dose, which is 500 milligrams, right? And then you want to reduce it by, so you're going to multiply it by 0.25. The new dose on that will be 125 milligrams. So the dose is going to be, the reduction in dose is going to be 125 milligrams, right? So the dose should be reduced by 25%. So you're going to now take the 500 milligrams and you're going to minus that from a 125 milligrams, right? And now you're going to get 375 milligrams. That's the dose every 8 hours. Q8 hours. And you'll see people do Q8 with that, or you can say somebody do Q8H, right? All these different things, but every 8 hours is what we're looking at. So keep in mind that the dose is being reduced by 25%, but the dose that they're going to give is the 375 because you have to reduce it by that amount. Some people will also say that you can just take the dose, 500 milligrams, and you can minus or times it by, if you take 100% and you minus 25, you'll get 75%. So you can kind of multiply by 75 and you get the same exact amount of the dose. All right, let's look at another one. This is a medication, propofol. It says that it's dosed 100 micrograms per kilogram per minute. So this is a liquid, so it's going to be an infused product, and it's going to be infused at 100 micrograms per kilogram per minute. This would be causing sedation is what this would be used for. So in order for a 48-year-old woman who is 5 feet 7 inches tall and weighs 190 pounds, what is the proper dose per hour using the patient's actual weight compared to the ideal body weight, compared to the adjust weight? So it's a lot of different things. This is not an elderly patient or geriatric patient in terms of 48, getting up there. But what is just the terms of dosing based on weight and looking at the different dose comparisons that we have. So let's first look at their age. This uses some of the calculations we did previously. The age is 48. All right. And the reason why I'm putting all these numbers is because what is the patient's dose compared to ideal body weight, right? And for ideal body weight, we're going to be needing that as well as the adjusted weight from previous sections. So the weight, we also need their weight in kilograms. So their weight in kilograms, we have 190 pounds. 190, I'm going to divide that by 2.2. I get 86, looks like 36 kilograms. Inches over 5 feet. Inches over 5 feet is 7 because they're 5 feet 7 inches tall. So their ideal body weight, recall from our previous one, 45.5 plus, this is 2.3 times 7, which is the inches over. All right. That's going to equal 61.61 kg. Now, we can talk about this in the previous thing, but if somebody is about 30% over their ideal body weight, then they would be considered obese. So what I'm suggesting here is that 30% of this number, so if I take, this is their ideal body weight, right? 30% over their ideal body weight. So I'm going to multiply that 61.61, right, times 0.3, so that's 18.483, which is 30%. Are they 30% above it? So I'm going to add that back into the number. So about 80.093. So this is the same as me saying what is 30%. I'm taking 1.3, that'll give me 30% of this number added onto it. So if I multiplied that two numbers, 30% more is 80.093, however you want to do it, the way I just did it, or this is the cheat method. This is 30% over, right? I'm adding it. So you can see that this is their actual weight here, and this is their ideal body weight. That is 30% more. So this is their ideal body weight, and this is 30% more. So they are over that 30% range, so they could be considered obese. And you can see that their adjusted body weight would be something that would allow us to give us a better dose, especially for these sort of things. So if we wanted to go through this, let's see if we did this, we want to go through it, we can look at, raise this up, we can utilize, so their actual, right, let's see, their actual dose. Right, the actual dose is 100 micrograms, 100 micrograms per kilogram. So let me do 100 micrograms per kilogram, which is 86.36. And per minute. Excuse me. If I wanted to know what their dose was for their ideal body weight, I would get 100 micrograms. All right, so I had to take that phone call, but back over here, look at their dosing for actual was, like I said, 100 micrograms per kilogram per minute. So I wanted to just to put the little unit here of minutes. Can I rewrite this without anybody getting angry at me? Let me just put the units more in there. So this was, actual was 100 micrograms, right, per minute times the number of kilograms, which is 86.36 kilograms. This one was 100 micrograms, again, per minute. But based on their ideal body weight, we calculate their ideal body weight to be 61.61 kgs. And then their adjusted excuse me, body weight, which we can do over here. Sorry, adjusted body weight. We're going to take their actual, which is 61.61 kilograms. And then we're going to add to it 0.4, remember, because it's 40%, times the difference between their real and their ideal. All right. When we do that, we get 71.51 kgs. All right. So their adjusted weight would be the same constant, or the same rate, 100 micrograms per minute. And this time we're going to multiply by 71.51 kgs. Now, the question says, what is the dosing per hour? These are all dosing per minute, right? So 100 micrograms per minute, 100 micrograms per minute times this. So I'm going to multiply actually all these by 60. 60, 60. What that's going to do is that's going to allow me to say this is the dose per minute, and this now is the dose, so multiply. This is the dose for an hour. Right? This is the dose per minute, 60 minutes in 1 hour. So when you do get these out, they're going to be, I'm going to convert them to milligrams. So you're going to get micrograms is going to be 518, let's see, 160 micrograms per hour. This one is going to be 369,660 micrograms per hour. And this is about 4290. This is about 429060 micrograms per hour. The dose is micrograms per hour is really high. It's like 429,000. Usually you would make that a little bit easier and just do it in milligrams. So you would say about 429. So this is about 429 milligrams per hour. This one is about 369 milligrams per hour, and this one is about 518 milligrams per hour. Now, the purpose of this, even though it took a long time, is you can see that the actual dose would have been 500 almost milligrams per hour. Based on their adjusted body weight, right, their ideal body weight rather, you would get a lower dose, 369. But because the person was obese, it is slightly higher, 429. So they would have got underdosed possibly with the ideal body weight, maybe overdosed with their actual, but adjustment on that is what was happening. And also it depends on the drug and how it's distributed in the body. But that is an example of utilizing the information we did before with ideal and actual and adjusted body weight and doing doses for patients. Okay, now we did dosing, as you can see, they're based on weight. There's also dosing that is sometimes based on body surface area. And so dosing that's based on body surface area being another form that you can do. So there are certain medications, and a lot of times in clinical practice, you're going to see that these are usually for drugs that are very significant in terms of toxicity. A lot of times the chemotherapy agents are used so that the dosing isn't really based on weight. So people with obese don't get over, people that are under don't get a low dose. So the body surface area that's typical for an average adult is 1.73 meters squared. And then using this value, you could make some ratio determinations as to the rate of a younger child or older. You can also use nomograms that can quickly determine what the body surface area is of a patient. And these you can see in your book in that in figure 8.3 in your textbook, which I'll pull up really quickly here. And the way in which one of these is done is that you would find the person's height and then the person's weight, and you would usually take a ruler or a straight edge and you would put a line connecting. So let's say the person's height was here, you would draw a line that matches where their weight was, and then there is where you would read the body surface area. So if you have somebody the same thing that weighed more, it would be up here. Somebody that weighed less, it would be down there for the same height and vice versa. So we are also going to look at a way to calculate that. So you can use a calculation for body surface area that we have down here. This is just one of those plugging into an equation. You do need to know the height in centimeters and the weight in kilograms. And the body surface area will come out in meters squared. So we take the first example. So let's calculate the BSA for a female, weighs 77.3 kilograms. So we have our weight in kilograms. That's good. And it says that they are 167.6 centimeters tall. We have our height in centimeters. So it's just a matter of plugging into that formula. So BSA is going to be square root of height in centimeters, 167.6 centimeters. This is going to be their weight in kilograms, 77.3. Which I really shouldn't put the units there because we're going to do a conversion factor, get rid of them. And then it's going to be divided by 3,600. And then you're going to take the square root of that. When you do that in your calculator, you should get about 1.897 meters squared. So now that you have a body surface area of a patient, then now you can actually do dosing based on that. So let's take an example. This is a chemotherapy Doxorubicin, it is dosed at 60 milligrams per meter squared, so it's 60 milligrams per body surface area that is metered squared, and it's dosed every 2 weeks. So it says what dose would a patient who weighs this amount of kilograms and is this amount tall? First thing we have to do is get their body surface area. So their BSA is going to be, as we have the square root of 71, which is the amount of kilograms that they are, as we see. And then we also need 185 is what their height is in centimeters. Divide all that by 3,600 and take the square root of that. It's going to be about 1.91 metered squared. All right. And I'm just going to clarify that this is meter squared. All right. So once we have that, now we do a dosing. And dosing is just the same we've always done, except we're just using a new term by using milligrams per meter squared. So the dose is 60 milligrams, right, per meter squared. The patient weighs has 1.91 meters squared of body surface area. Therefore, our dose is going to be 114.6 milligrams, and this is going to be Q2 weeks. So every 2 weeks, they're going to get that. That is the milligrams per meter squared per dose, and that's the every 2 week is that dose. Another common dose adjustment that we make is based on renal function. As we saw in the previous example, it was just a reduction by a percentage, but we also can calculate renal function in patients that have it impaired, and then we can make dose adjustments to that. There are a few calculations out there for measuring renal function. They usually are excuse me, common in terms of patients that have kidney disease, and also there's some that are done for liver as well, some other types of dose adjustments. So for us, we're looking at kidney. We're going to be looking at the Cockcroft-Gault equation, and we measure this in terms of creatinine clearance, which is, so creatinine, as you see down here, it is a substance that's in our body, and then in general, I can describe it as something that's produced by your muscles, and it's excreted and it is filtered through your kidneys at a constant rate. So therefore, somebody with renal impairment, if you measured their serum creatinine, you would see elevations. So an average adult is going to be about 0.8 to 1.4 milligrams per deciliter is an average range for a creatinine clearance, or sorry, a creatinine level. So you see as they get higher, you will see the person probably suffering from renal impairment. The equation is separated slightly for male and female. For males, the creatinine clearance, which is a measure of how much is being limited per minute, you've got the number 140 minus the age in years. We have weight in kilograms. We have 72, and then you have a serum creatinine, which would be measured. So this is what's measured from the lab. It's plugged into the formula, and you get somebody's creatinine clearance. For females, it is multiplied by the number multiplied by 0.8. The thing to keep in mind is that the weight in kilograms for us in this course, we are going to use actual body weight. There are some times where people will use ideal body weight or adjusted ideal body weight. We will, like I said, just stick with the actual weight of the patient. We're not going to make any adjustments in these sort of calculations. It would just be a simple plug into the formula. So what is the estimated serum or what is the estimated creatinine clearance? 72-year-old male. We had a height, and we have weight, and we have a known serum creatinine. So plug it into the formula. The creatinine clearance would be equal to 140 minus the age, this person's 72, times their weight in kilograms, 63.8. It's going to be divided by 72 times the serum creatinine in milligrams per deciliters. It's already given to us in milligrams per deciliter, so 3.1. When I take those and plug them into the formula, we're going to get about 19.44. 19.44, this is mLs per minute. So you can say the person has about a 19 mLs per minute is their creatinine clearance. So once you dosed, once you got the value of a serum creatinine from the lab and you calculated their serum creatinine, then this would be an example of how you utilize that. So this is a dosing for an antibiotic, and it says here's your serum creatinine in milliliters per minute. If the person is less than 20, if the person is in a normal range, in a higher range, if the person is severely impaired, what you would actually, going backwards. So if the person has good clearance, but as you go down and this becomes worse, right, as their creatinine clearance slows down, that means your renal impairment is slowed. You have less dosing. So you can see that dosing here is every 8 to 12 hours, and here it's every 24 hours, and here you physically have to monitor it. So looking at this question, it says what dose of antibiotic would be recommended for a patient in the above. So if we were trying to dose this antibiotic and the person had a 19 milliliters per minute serum creatinine, where would we do it? We would be doing it by the so based on that, we would have to determine it by serum creatinine. But let's say that the person's serum creatinine was 20. The creatinine clearance was 20 mLs per minute, right? So let's say we were in this range right here, and we had to do 15 milligrams per kilogram. That's what we would do. We would do 15 milligrams, right, per kilogram, which is 63.8. And that would give us about 957 kilograms. 957 milligrams Q 24 hours is what that would be if the person had a 20. All right.